Hello everyone, very good evening to all of you and welcome to the class. So I hope you all are going good and well and in this last 20-25 days. So thank you Ajay. Hi Abhijit. So I hope you all are doing good and we are ready for the next bout of the questions. So this is a rapid fire session part 3. So this is targeting our NEET PG. Those who are preparing for FMG exam, it will be also effective for them. Those who are going to write INICT. So this is a mixture of thing where you are going to learn the concept also, MCQs also, and that is going to help you a lot in your exam also, right? Fine. So let's start. Namaste, Tapendra. So let's start. This is the question number 1. A pigment was seen in a biopsy obtained from a heart patient and it was positive for a specific special stain. So now you can see the pigment here and there is a specific special stain. So this is the special stain and this is the pigment you are seeing here, right? So tell me what should be the right answer. Most likely it is due to what? Yes, very good. Try it. So first of all, you have to identify what is the pigment. It's not A. I'm not getting correct answer. Rabina's hyperplasia. A. Very good. At least you are thinking something. No, not atrophy. Not atrophy. Okay, first correct answer I have got from Rahul P. Right? So Rahul has given me the first correct answer, and that is the D. Right? So that is the D answer. So for this question, Rahul has given me the first correct answer. That is the right. So it is D. Yeah, these are derived from the previous year question. I have made the amalgamation of the question, right. So now these are the previous year question plus something I have made. Yes, Rahul, very good. This is the thalassemia case, right? So see what I am showing you here. Try to understand what I am showing you here. There is a myofiber. Can you see? This is the myofiber, right? And in this myofiber you can notice there is a nucleus, right? And around the nucleus, can you notice there are brown pigment? So this is the perinuclear brown pigment, right? So this is the perinuclear brown pigment, right? So this is the perinuclear brown pigment. And now look at the this is stain, right? What stain I am showing you here? Can you notice all the things are looking blue spot, right? So this is the Pearl's Prussian blue stain. So here I am showing you Pearl's Prussian blue stain, right? Pearl's Prussian blue stain. See here, I would like to tell you one thing. Whenever you see a brown pigment, what should be your thought process? Please remember, whenever you are seeing a brown pigment, what should be your differential diagnosis for the brown pigment, right? So brown pigment, we will be having two differential diagnoses, right? We will be having two differential diagnoses in our mind. It can be either lipofuscin, right? It can be either lipofuscin or it can be iron deposition or hemosiderin deposition, right? So lipofuscin or hemosiderin. So whenever we think about lipofuscin, so we will be using a special stain, right? So we are going to use a special stain to confirm this, right? So now you understand. So if you are thinking lipofuscin, so see the name itself is telling lipid, right? So if you are suspecting lipid or lipofuscin, so what stain we are going to use? Oil red O stain, right? Oil red O stain. And what will be the color of lipid? So lipid will be red in color. So remember, this red color will be the color of lipid by oil red O stain. There is another stain which we can use for lipid, that is the Sudan black B, right? Sudan black B is also used for lipid, and in this lipid will be looking black in color. So please remember Sudan black B. Here you are going to see lipid will be looking black. So now you understood. So here neither it was red color nor it is a black color, right? So it is not a lipid. So lipid is ruled out. So what was the color? It was Pearl's Prussian blue stain. So remember what I have shown you, Pearl's Prussian blue stain. So whenever you find a Pearl's Prussian blue stain positivity, it means it is a iron which is present in the Fe3 plus form, right? So this is the iron accumulation. So now you can see that if you come back to the question, a pigment was seen in the biopsy obtained from the heart patient, and it was positive for a specific, right? It was positive for a specific special stain. So why there is a, so now you can see that perinuclear brown pigment which is positive for the Pearl's Prussian blue. So what is our inference? What is our inference? This will be the iron accumulation, right? So we can say that this is the case of iron overload, right? This is the case of iron overload. So obviously it is not seen with hypertrophy, atrophy or hyperplasia. So where we will see, because of the multiple units of the blood transfusion, oil overload, the iron overload will be seen in the cases of the thalassemia, right? So this will be the thalassemia case where you will see iron overload, which will be seen as a perinuclear brown pigment, and Pearl's Prussian blue stain will be positive to identify iron stain. So you all understood this point. So everybody, you got it, this point. So now you will not commit this mistake. So now you understood perinuclear brown pigment, two types, iron and lipofuscin. But when you find Pearl's Prussian blue is positive, it means it is a iron, and iron overload can be seen in thalassemia because of the multiple units of the blood transfusion. RBC will be getting damaged, and from the damaged RBC you will be seeing the iron, and they will be having excessive iron absorption also. So these are the two routes for the excessive iron absorption in the case of thalassemia, right? So answer was thalassemia, right? Let us see see this question I have shown you. This is the perinuclear brown pigment, and this is the Pearl's Prussian blue stain. Now I want to show you all the other stains which I have discussed here. So this one is oil red O stain, right? So this one is oil red O stain, right? And whatever you are seeing red color, these are all oil or lipid accumulation, right? This is a Sudan black B positive, right? So this is the Sudan black B stain, right? Where you can see this black color is the lipid accumulation. So lipid is black here, lipid is red here. So oil red O and Sudan black B, these are the two stains. And remember, oil red O stain is the best stain for lipid on frozen section. So remember, it is best for frozen section to identify lipid, right? Clear? So nice question. Now you enjoyed this. Now let's start with another question. Increasing severity of the disorder over generations is a result of. So tell me, it's an easy question, right? This is the easy question, repeat question. Right, so here I got the first correct answer, right? So first correct answer is given by Nikhil Deshmukh, right? So very good, Nikhil. So Nikhil has said that it is because of trinucleotide repeat mutation, right? So increasing severity of the disorder over generations, right? So it is usually seen in trinucleotide repeat mutation disorder. What happens here? See this, in trinucleotide repeat mutation disorders, right? There will be the repetitions of the codon, right, which is present in the triplet, right? And these codons, when they are going to amplify after some certain time, so they will be showing you disease also, right? So this will be amplified and transmitted to the next generation by a oogenesis also and via spermatogenesis also, right? So here by oogenesis, example is fragile X syndrome, and via spermatogenesis, answer is Huntington's disease, right? So this is how you remember, that is the triple nucleotide repeat mutation. So I will just take example of the Huntington's disease, right? Suppose we talk about the father who is suffering from Huntington disease, and assume that he is having 300 repeats, right? And he has got this disorder by the age of 35 years, right? So what is going to happen when he will have a spermatogenesis, number of repeats will be increased. And now when you will see his son, right, now son has acquired say 600 repeats, so number of repeats have been increased, so severity of the disorder will be increased, and the onset of age is also earlier, 25 years, right? So this is the entire process, right? This is the entire process which I wanted to explain you. So when you are going to see this kind of presentation, right, from the father to the son, right, disease has been transmitted, and you can notice here the severity. If you have more number of repeats, severity will be more. So severity of the disorder has been increased, and there is a early onset in the next generation. So increased severity, early onset of the disease in the next generation. So that means it is a anticipation. So this process is called as anticipation, which is seen in trinucleotide repeat mutation disorder, right? So what is anticipation? Increased severity of the disorder, early onset of the disease in the next generation. So this is the full definition or precise definition of the anticipation. Increased severity of the disorder, early onset in the next generation is called as anticipation, and anticipation is associated with trinucleotide repeat mutation disorder. So now is it clear? So here answer should be D, right? So trinucleotide repeat mutation is associated with increasing severity of the disorder over generations, right, which is called as anticipation. So what is this? This process is called as anticipation, right? Fine. So let's move on to the next question. CD4 FOXP3 CD25 containing T cell will act through perforin granzyme, act through CD8086, or process the antigen, or produce TGF beta. So what should be right answer here? Right, good. Okay, Prashant Kumar Mohapatra has given me the first correct answer. Then Raja Ravi is also telling me the correct answer. Then Nikhil Deshmukh. Okay, that's great. Let me see how many of you are giving me the correct answer. Right, so here see, this answer is D, right? So here answer is D, because CD4 FOXP3 CD25 containing T cell. So what is this T cell? Can you tell me? What is this T cell we are talking about, where you are going to see all these things? So these are the regulatory T cells. These are the regulatory T cells, right? So on the regulatory T cells, we will be having all these receptors, right? So they are derived from CD4 helper T cells. CD4 will be present. They are having FOXP3 and they will be having CD25, right? And what we need to remember that, see, this FOXP3 and CD25, right, they will synthesize anti-inflammatory cytokine, right? So they will synthesize anti-inflammatory cytokine like a interleukin 4, 6, 10, TGF beta. So all these anti-inflammatory cytokine, what is their function? Their function is to inhibit right, autoreactive cells. So they will inhibit autoreactive cell proliferation. So they will inhibit the development of autoreactive cell, and that is how they are going to prevent autoimmunity, right? So by this method they are going to prevent autoimmunity. So that is why regulatory T cells, these are the receptors, right, which are present on them. FOXP3, CD25, they will help in synthesis of all anti-inflammatory cytokine, and one of them is TGF beta. What is their basic purpose? To inhibit autoreactive cell and to prevent us from getting any autoimmune disorder, right? So that is the correct answer. Right, act through perforin and granzyme. So can you tell me perforin, granzyme, who will be acting through the perforin and granzyme? First option answer should be natural killer cells and CD8 cytotoxic cells. So please remember, this is the another important question which examiner can ask you in NEET exam, right? Perforin granzyme is present in the granule of natural killer cells and CD8 cytotoxic cells, right? Now can you tell me act through CD80 and 86 on their surface? So can you tell me which cell will be having CD80 and 86 on their surface? CD80 and CD86 is present on their surface. What is the name of this cell? Anybody? CD80, yes, very good. That will be the antigen presenting cell. CD80 and 86 are present on antigen presenting cells, right? CD80 is called as B7.1, 86 is called as B7.2. So they are present on antigen presenting cells, not on the T cells, right? So that is the another different option. Process the antigen. So processing of antigen is also done by antigen presenting cell. So now you can see that first option, second option, third option all are ruled out. So what is remaining? TGF beta, and that is the straightforward conceptual question. So what we need to remember, regulatory T cells are present in the peripheral blood. They are modified helper T cell. Remember, they are modified helper T cells. What they will do, their CD25 and FOXP3 will synthesize anti-inflammatory cytokine to inhibit autoreactive cell proliferation, and that is how they will prevent autoimmunity, right? Is it clear to all of you? So answer is D, right? Answer is D. Now come to the next question. Read this and tell me what should be the right answer. I'll give you half minute. Right, so Prashant, Amit, Raja Ravi, Keval, Sangvi, Padma, Sharan. Very good, very nice. So I think all of you have given me the correct answer. All of you have given me correct answer. So 10-year-old, see the question is 10-year-old black girl, severe pain in her chest, abdomen and bones, right? Physical examination is showing jaundice, anemia. Her parents state that she has had been anemic since 1 year of her age. Splenic biopsy is shown below. So this is the splenic biopsy we are seeing. This is the HE section. This is the Pearl's Prussian blue stain, and this is the von Cosa stain, right? This is the von Cosa stain, right? So that is what examiner is writing. Most likely true statement about this black girl, pain in chest, abdomen and bone. So what do you think that? What is this? What is your diagnosis? This is the sickle cell anemia, right? So what I am showing you here, this is a case of sickle cell anemia, and first line is about vaso-occlusive crisis, the most common clinical presentation, right? Vaso-occlusive crisis, pain because of the they will be blocking the blood vessel, and that will be leading to the ischemia, infarction, and that is why there is a pain in the chest, abdomen and bone, right? Physical examination is jaundice because of the hemolysis, bilirubin, and indirect bilirubin will be formed, and she is having anemia also, right? Her parents state that she has been anemic since 1 year of the age. Why 1 year of the age? Because because till the 7 months, till the 7 months of her life, there is a fetal hemoglobin, and that will not allow any sickling or hemolysis, right? So now you understand, fetal hemoglobin will be predominant up to the 7 month of the age of the kid. So that is why sickle cell anemia is not seen up to the symptoms and signs are not seen up to the time of 7 month or up to 1 year, right? So their clinical features will be seen only after more than 1 year, or more than 7 days, sorry, 7 months to 1 year, right? So 7 months to 1 year. So here I would like to just modify when it will happen, when they are more than 7 month or maybe 1 year, because till that time fetal hemoglobin is present and they will be preventing sickling. So there is no sickling, no hemolysis, no jaundice, no anemia, right? So this patient will be asymptomatic till 7 month, right? Now you can see there is a HE section, there is a Prussian blue von Cosa. So HE section, what we can see, there are dark color area and there are so much of fibrosis, right? Fibrosis. Then dark color area can be the, these are amorphous basophilic material, so it can be calcium, right? And that will be confirmed only by the von Cosa stain. So now you can see that this is the von Cosa stain, right? So this is the von Cosa stain showing you calcium. This is Pearl's Prussian blue stain showing you iron, right? And here you can see these are the areas showing you the fibrous tissue of the spleen. So fibrous tissue, iron plus calcium, all these three things together will be forming gamma Gandhi bodies, right? All these things are gamma. I will explain all the options, don't worry, right? So what I am showing you here, in this diagram, right? In this diagram, what I am showing you, iron, calcium and fibrous tissue of spleen, right? Fibrous tissue of spleen. So all these three things together, what are they forming? They are forming gamma Gandhi bodies. So these three things together are called as gamma, remember it is N which will be silent, gamma Gandhi bodies. And what is the clinical significance? Can you tell me? Gamma Gandhi bodies are suggestive of what thing? Anybody? Gamma Gandhi bodies are suggesting of what thing? Gamma Gandhi bodies are suggestive of congestive splenomegaly, right? So they are suggestive of congestive splenomegaly, which can be seen in chronic myeloid leukemia also. It can be seen in liver cirrhosis also, right? And it can be also seen in the sickle cell anemia, as we are seeing in which condition? Sequestration crisis. Sickle cell anemia sequestration crisis will be having this thing, right? So now as I said, these are the gamma Gandhi bodies. So iron stain, calcium stain will be positive, as we are seeing here, right? So this is the iron stain, calcium stain, right? So now we came to know that this is the case of sickle cell anemia, showing you all these, sequestration crisis, right? So here what we have to do, right? So one by one we are going to see the options. Sodium diethionate. What is sodium diethionate test? It is a screening test for the sickle cell anemia, where it will create hypoxia to the RBC and they will be having sickling and then they will be having hemolysis, right? So now I understood. So sodium diethionate test is a screening test to identify, it is a screening test for identification of sickle cell anemia, right? So it is sickle cell anemia screening test. Ham's test. What is Ham's test? What is Ham's test? Ham's test is used for screening. This is also a screening test, right? Right now we are not doing Ham's test very regularly, right? So Ham's test is a screening test for the diagnosis of the paroxysmal nocturnal hemoglobinuria, right? So please remember, this is also a screening test, not confirmatory. Not confirmatory. Screening test for the PNH. What happens in PNH, right? In PNH we will take the blood sample, right? We will take the patient's blood, right? Patient's blood, and then we are going to add mild acid, right? Mild acid, because this mild acid is going to activate the complement pathway, right? So this mild acid is going to activate the complement pathway, and complement pathway is going to form the C5C9, which is also called as membrane attack complex, right? So now you understand. So membrane attack complex will be formed. So what they are going to do, membrane attack complex is going to attack the RBC and they will cause the RBC lysis. When it will cause RBC lysis? If it is a PNH patient, right? Because in a normal individual, normal individual, their stem cells will be having, GPI anchor protein, which is holding the complement regulatory protein, and this complement regulatory protein will not allow damage by the C5C9. So now understood. So this is for the normal individual. Clear? So now you understood this point. So normal individual, so that is why PNH is a Ham's test, is screening test, and that is how you can see that this is not a PNH case, right? Ham's test is used for PNH is screening, right? PNH is screening, and that is why it is not a true statement. Chest pain is anginal pain. See, sickle cell anemia, acute chest syndrome will be there, right? Acute chest syndrome will be there, but that pain will not be radiating, right? Angina pain will be radiating. Angina pain will be radiating. Chest pain is not radiating, right? So here chest pain is not radiating in case of sickle cell anemia. So that is why this is a false statement, right? So now you can see that first A, B, C all are incorrect, and correct answer is aplastic anemia may be seen. When it can be seen? When you are going to see they are associated with parvovirus B19 infection, just like a hereditary spherocytosis, right? So parvovirus B19 infection will cause transient aplastic crisis, and that time they will be having aplastic anemia, and this transient crisis will be for 5 to 7 days, right? Is it clear? Right. Chest pain is not because of the arteries. Remember, here chest pain is because of the lung tissue infarction. It is not because of the coronary artery. Right, Mehul? It is not because of the coronary artery. Here chest pain is not the heart, right? Here chest pain is because of the lung tissue has been infarcted. That is why patient is having pain and the dyspnea. Right? It is not because of the cardiac tissue. Right? So now you're done. So D is the right answer. Now come to the next question. An 18-month-old girl has developed seborrheic skin eruptions over the past 3 months. She had multiple bone permeating lesions throughout the body. A skin biopsy was done and biopsy finding is shown below. Which of the following is correct about this tumor? Tell me, which is correct? Easy question, by image you can easily identify, but options may be little tough. Sharan Patel has given me the first correct answer. Raja Ravi has given me the first correct answer. Raja Ravi and Sharan Patel. So that's great. See, 18-month-old girl, seborrheic skin eruptions, 3 months, right? Multiple bone permeating lesion throughout the body. Skin biopsy was done, and this is the electron microscopy, right? So this is the electron microscopy of the skin biopsy. So which of the following is correct about this tumor? So first, when we see this kind of structure, this is the pentalaminar rod-like structure, right? So these are the pentalaminar rod-like structure. Can you see this? This is the pentalaminar rod-like structure, dilated terminal end. So what is this? This is the tennis racket appearance. Remember, tennis racket appearance. And what are these things? These are actually Birbeck granules. These are actually Birbeck granules. And whenever you find Birbeck granules, right? So please remember, whenever you find Birbeck granules, right? So it will be positive, it is made up of langerine protein, right? It is made up of langerine protein, and langerine protein marker is CD207, right? So Birbeck granule is present into the cytoplasm of Langerhans cell. So remember, where is the location? These are all present in the cytoplasm of the Langerhans cell, right? So once you find this langerine protein, right, CD207 Birbeck granule in the cytoplasm, in the electron microscopy, that will confirm the diagnosis of which disorder? Langerhans cell histiocytosis, right? So this is a picture of Langerhans cell histiocytosis. So in Langerhans cell histiocytosis, which of the following is correct about this tumor, right? So one by one we will see. If you look at the first option, CD200 is langerine protein. So CD200 is not langerine protein, it is CD207, right? It is CD207 which is langerine protein. CD200 is used for diagnosis of the chronic lymphocytic leukemia, right? Chronic lymphocytic leukemia we are going to use, right? Tennis racket cells are seen ultrastructurally. Ultrastructurally means electron microscopy, right? So this is not tennis racket cells. Please remember, it is not cell. It is tennis racket appearance. Tennis racket appearance, right? So we are talking about electron microscopy, right? So tennis racket appearance will be seen in this one, right? Here again, I would like to tell you one thing. Whenever examiner is asking you this word tennis racket, right? So you have to be very careful, right? You have to be very careful. Tennis racket, right? Tennis racket can be of two things, right? It can be tennis racket appearance, or it can be a tennis racket cells, right? So tennis racket appearance is seen on electron microscopy in Langerhans cell histiocytosis, right? Tennis racket cells are seen on light microscopy, and it will be seen in rhabdomyosarcoma, right? So we have to be very careful. So in rhabdomyosarcoma, a special type of rhabdomyosarcoma which examiner asked, sarcoma botryoides, right? So sarcoma of the vagina. So this is the very important thing to understand. What examiner is writing, tennis racket cells or tennis racket appearance, right? So appearance and cells both are different, right? Right. So now you can see here again coming back to the gonadal involvement. So gonadal involvement is not seen in this case. Gonadal involvement is rare or absent. So this is the wrong statement. So A, B, C, all three are wrong. So what is remaining right now? D option. That is the tumor cells will be S100 positive. Yes, so that will be correct statement. So this tumor Langerhans cell histiocytosis, IRC marker is CD1A, the best marker. They will be positive for CD207, right? They will be positive for S100, right? So all these are important marker for the Langerhans cell histiocytosis, and gonadal involvement will be absent, right? So now I understood, answer will be D. Now coming to the next question. A 70-year-old male complains of difficulty in remembering and gait disturbances, and electroencephalogram reveals periodic spike wave complexes. 1 month later, the patient dies. A section of brain tissue is obtained at autopsy is shown in the image. Which of the following is not true? So tell me, what should be the right answer for this question? Which is not true? Right, so I have got the first correct answer by Prashant, and answer is D. So by seeing this histopathological examination and the history, can you see the history? 70-year-old male, difficulty in remembering and gait disturbances, right? EEG showing you periodic spike wave complexes, right? So this kind of history, when you see gait disturbances, means brain involvement, periodic spike wave complexes on electroencephalogram. So what will be your diagnosis in this case? In this case, our diagnosis is Prion disease, right? It is a Prion disease. So what is not true? So Prion disease, do they have longer incubation period or shorter incubation period? Can you tell me in the comment box? Longer or shorter? What is your answer? Longer or shorter? So this is the Prion disease, and they will be having, see, remember, periodic spike wave complexes. Please remember here, I would like to tell you two important points. Prion disease will be having periodic spike wave complexes, right? So periodic spike wave complexes and progressive dementia So all these are typical feature of the Prion disease: periodic spike wave complexes and progressive dementia. So that will be the feature of the, yes, these are the slow virus disorder, and they will be having longer incubation period, right? So the first statement which is given here is the correct statement, longer incubation period. It is because of misfolding of the protein. True or false? Misfolding of the protein. Will you find misfolding? Yes, there will be a misfolding of the protein. So that is also a true statement. So Prion disease is a misfolding protein disorder where prion protein will be getting abnormal, and excessive prion, remember this PRPSC, this excessive amount of the prion protein is going to undergo misfolding, right? So they are undergoing misfolding of the protein, and this misfolding is going to cause damage of the neuron. So this is going to cause damage of the neuron, and this will be looking like a cluster of grape. Can you see there are cluster of grape like vacuoles are present in the cytoplasm? So when you find cluster of grape like, because of the damage of the neuron due to the misfolded protein, so such kind of neurons are called as spongiform neurons. Such type of neurons are called as spongiform neurons, and spongiform neurons are seen in Prion disease, right? So that's true. So it is misfolded protein syndrome, right? Prion disease, right? Associated with neurosurgery. So that is also a true statement. Contaminated instruments can be the source of the infection of this Prion disease. So that is also one very important. So in this diagram, if you look at this, spongiform neurons are there, and spongiform neurons are never seen in the fatal familial insomnia. This is one very good example, and just remember this is the right answer, right? Spongiform neurons are not seen. They will be seen in all kind of Prion disease, but not here. So you can see here we are seeing cluster of grape like cytoplasmic vacuoles, which is why they are called as a spongiform neuron, right? Which is seen in the all Prion disease: Creutzfeldt-Jakob disease, Kuru, Scrappy, mad cow, but it is not seen in the fatal familial insomnia, right? So that is the point you have to remember. It is not seen in the fatal familial insomnia, right? Is it clear? No, Hirano bodies are not present here. Right? So now I understood what should be the right answer. So the answer is D, seen in fatal familial insomnia. This is the false statement, right? Now coming to the next question. A 34-year-old female with the breast cancer was showing you following immunohistochemical pattern. Which of the following is true regarding this cancer? This kind of question can come in your exam. Something is going to come in your exam from this classification of the breast cancer. Yeah, they are specific for the Prion disease. Ramakrishna, that periodic spike wave in EEG is specific for the Prion disease. Progressive dementia, periodic spike wave appearance in EEG is specific. Right. So first correct answer is given by Prashant. Very good. So first correct answer is given by Prashant, that is the C. See what I am showing you, breast cancer, and in this breast cancer this is the HE section, and then you can see there is a ER, PR and HER2, right? So if you look at the ER, PR, so whenever you find brown color, so that means it is a positive, right? So what I'm showing you, it is ER positive and PR positive, right? ER, PR both are, remember, both are nuclear stains, right? Both are nuclear ISC, right? So both are nuclear ISC, you can say, right? Both are nuclear ISC. Then they will be positive for the nuclear thing. So ER is also positive, PR is also positive, right? But when we are seeing the HER2, HER2 is negative. HER2 is negative, right? So ER, PR positive, HER2 is negative. So ER, PR positive, HER2 negative is a luminal A type of breast cancer with BRCA2 positive, and they will be usually having good prognosis, right? So this is very, very important. So this is the luminal A, BRCA2 positive and good prognosis. Now I am going to explain you this molecular classification of the breast cancer. There are 5 categories: luminal A, luminal B, HER2, basal, Claudin low, right? So that is the molecular classification of the carcinoma of the breast. Luminal A will be positive for HER2, right? HER2 negative, not positive, HER2 negative, and they will be positive for ER and PR. So luminal A, luminal B, you can see in this classification, if you notice, luminal A and luminal B both are estrogen positive, progesterone receptor positive and BRCA2 positive, right? That is the common finding. So what is uncommon finding is the status of HER2. Luminal A is HER2 negative, luminal B is HER2 positive. Because of being negative, they will be carrying best prognosis, because HER2 is present on the in luminal B type of cancer cells, and once you find HER2 is positive, that means they will be having bad prognosis, right? Bad prognosis, right? So here right, HER2 positive will be having HER2 positive, ER, PR negative. So HER2 positive, ER, PR negative, that is the HER2 positive breast cancer, because HER2 positive, so they will be also having bad prognosis. Basal carcinoma, see, base means 0, all will be 0. HER2 is 0, ER 0, PR 0, means all are negative. ER, PR, HER2 all are negative, and they will be BRCA1 positive, and they carry worse prognosis. Claudin low is marker of intercellular adhesion. Claudin 3, 4, 7 will be present. There will be decreased expression of the E-cadherin. ER, PR, HER2, they are all negative or absent. So this is just like a triple negative. See, basal is also triple negative and they carry worse prognosis. Claudin low is also having poorer prognosis, right? Just like a basal cell carcinoma, right? So that is the point we have to remember. So now you can see in this we are seeing ER, PR positive, HER2 negative. So it is a luminal A type of cancer, BRCA2 positive, and they will be definitely having good prognosis. So this molecular classification which I had explained you, that will be definitely helpful for your exam, which examiner is going to ask in upcoming exam, right? Now coming to the last question, this is the last question, right? Liver tumor biopsy is shown below. Which of the following is not correct about this tumor? HER2 is a epidermal growth factor receptor, right? Their growth factor receptor, HER2 is a growth factor receptor, which is also called as ERB-B2, and trastuzumab antibody will be acting on them, right? So here first correct answer is given by Raja Ravi, right? So Raja Ravi has given me, no, Mayank, Dr. Mayank has given me the first correct answer. Raja Ravi then has given me the correct answer. This is a picture. If you look at this liver biopsy, see the liver tumor. So in this liver biopsy, can you see there are two components which are very strikingly visible. Number one, the tumor cells. Can you see these are the tumor cell component, right? These are the tumor cell component which is in the sheets or the nest, and in between the sheets and all, there is a area which is showing you fibrosis, right? So this is showing you fibrosis. So that is why you can see the tumor island. So what I am showing you here, right? So what I'm showing you, it is a tumor island, right? Tumor island which is surrounded by fibrous tissue. So that is why this type of hepatocellular carcinoma is called as fibrolamellar type of hepatocellular carcinoma. So fibrolamellar type of hepatocellular carcinoma is a good prognostic type of hepatocellular carcinoma, where you will find they are not associated with hepatitis B or C or any hepatitis infection, right? So it is not associated with hepatitis infection, right? So what they are having associated with, so they are having no association with any of the hepatitis infection, any of the alcoholic liver disorders, and that is why they will be having better prognosis, right? They have better prognosis. And if you look at them, alpha fetoprotein level will be normal range, right? So they will be having normal alpha fetoprotein. So better prognosis, alpha fetoprotein will be normal. They will be having no association with the hepatitis B virus, and fibrolamellar, because AFP level is normal, right? AFP level is normal. So what should be the tumor marker? Tumor marker in these cases, can you tell me what will be the tumor marker? Yes, neurotensin will be the tumor marker, right? So neurotensin is the tumor marker, right? So neurotensin is the tumor marker for fibrolamellar. So now you can see in this option one by one, if you look at, you can notice that neurotensin is a tumor marker is a correct statement, right? Hepatitis B virus is an important risk factor, that is the false statement and our correct answer, right? Often has a better prognosis, because yes, they will have better prognosis, and AFP level will be normal in these patients, right? So now you understood. So they are not like a hepatocellular carcinoma. In hepatocellular carcinoma, AFP level will be increased, but in fibrolamellar hepatocellular carcinoma, alpha fetoprotein level should be normal, right? So now these are the important point we have to remember, right? So now coming to the last slide. So just remember, this is just simple motivation to all of you. Remember, you might be thinking this is not possible for me to cover all the subject or read all the things and to crack this exam. See, so that is one absolutely hypothetical things which we are thinking, right? But when you will think with the cool head, then you will understand that whatever you have read or whatever you have made in your notes, if you are able to revise, maximum question you can get correct in your answer, right? So that is what I wanted to say, that everything is theoretically impossible until it is done. So you have to make your mindset in a positive manner, so that you should always keep working hard in that direction, right? Even though maybe having limited resources with yourself, right? But if you have very positive mindset, you can do anything. So thank you so much to all of you for coming, and my best wishes for your exams.